Signs to know you're having an infection in your body. If you're having any of these signs I'm about to mention, just know you're having one or two infections and you need to go for a test immediately. If you're having recurring boil either around your pubic region, your armpit, or somewhere around your neck, okay, that's a sign of you having one or two bacterial infections, possibly staphylococcus infection. Because if staphylococcus infection makes way into your hair follicle, you are definitely going to be having boil. Another sign to look out for is if you're always having stomach rumbling, like stomach noise, like brrr, most times, okay? That shows you're having one or two bacterial infections, such as Escherichia coli, that's E. coli, because it causes your stomach to produce some certain gas, okay? And that will result in stomach rumbling or stomach noise. Another sign to look out for is if you're always having itching in your body, especially after bathing. You need to quickly go for tests, okay? You need to go for tests if you're having that as well. As a man, if you are passing urine and you notice your urine splitting at the onset, your urine splits, okay? It doesn't go straight, it splits when coming out. Before it forms a narrow flow, at the onset it splits. That's enough signs for you to know that you're having one or two infections. Although it's not only infection that causes that, some issue with prostate can also cause that, okay? But you need to go for tests if you're noticing your urine splitting, okay? Or dividing when coming out. Another sign to know you're having an infection is if you're always having what we call swollen lymph nodes. What we call lymph nodes. If you remember when we were younger, whenever we have fever or malaria, okay, we usually have something swollen around our, okay, between our laps there, our thigh, or sometimes it comes around armpits or something around your neck, okay? That's what we call lymph nodes. Those lymph nodes are usually very common in children because at that point, their immune system is still developing, and when we get older, we no longer see much of that lymph node because by then, the immune system has actually adjusted, has made some structural adjustments, some structural changes. It has adapted to most of the infections our body do encounter. But if as an adult, you always have these recurring lymph nodes, either your armpits or in between your thighs, or around your lap, okay, or around your neck, just know your body is dealing with one or two bacterial infection as well. Another sign to know that your body is dealing with bacterial infection is if you're always having fatigue.